Hi, my name is Anthony Serpa, student nurse. I'm here to do my checkoff. Alright, so I'm going to get to the fixes. I have my patient here, a lot of fallings. Date of birth 10/5/26, okay. Allergic Tagamet and codeine. And let's get the medication 9 a.m. It's digoxin 250 micrograms, so let's go ahead and get it. Digoxin 0.25 milligrams, it's equivalent. And digoxin, before I would give this, I would hold. If potassium is less than 3.5, I would hold. If apical pulse is less than 60 within 1 minute, I would also hold if digoxin level is above 2.0. Famotidine, 20 milligrams IV BID. So we got famotidine, 20 milligrams per 2 milliliters, expires 2022. This makes sense because I looked at my drug guidebook and 2 milliliters is equivalent to the 20 milligrams of famotidine, so it makes sense. Practic regular insulin 6 units of Q, BID. I got insulin, Practic regular insulin, 100 units, not expired, 2029. Same with this one, not expired. And with insulin, I wouldn't give it if the insulin was below 110 to prevent hypoglycemia. So I got my first check done. My second check at the nursing station. So let's go ahead and do it. So a lot of fallings. Okay, here we go, a lot of fallings. Tagamet and codeine. Let's go ahead and get the med check. Digoxin 250 micrograms, digoxin 0.25 milligrams, expires 2023, ready to go. Famotidine, here we go, famotidine, 20 milligrams per 2 milliliters, expires 2022, ready to go. Practic regular insulin, 6 units of Q. Practic regular insulin, regular, expires 2029, so that's ready to go too. So let me go ahead and sanitize again, and then we're going to go ahead and prep the medication. So for the digoxin, you can go ahead and just put that ready to go right here. Let's go ahead and prep insulin. So we need insulin syringe. We'll need this. So regular insulin, we're going to scrub it out for 30 seconds. For 30 seconds. We get 6 units. Pull back 6 units. I'm going to verify with the nurse 6 units here. Is this 6 units? It is. Thank you. Go ahead and verify with you guys. 6 units. 6 units. Okay. Beautiful. And go ahead and recap right here. Wonderful. Discard that. Okay, discard that. And now we got to do one more. Here for your, we'll need this one and this one. This is going to be for your famotidine. So let's prep this syringe here. And scrub the hook for 30 seconds. It's been 30 seconds. So we need 2 milliliters. So what's going on right now is that this famotidine needs to be diluted in a normal syringe, normal saline syringe, which is over there. So I'm going to go ahead and withdraw it here. That's it right there. There we go. Get rid of the bubbles. It's 2 milliliters. 2 milliliters of famotidine. And we have that ready to go. So we're going to empty out this normal saline here. I'm going to get rid of 2 to get to 8 milliliters of normal saline, so I can create some space here. So I can put the famotidine in here. Okay. All right. I will discard this in the straps container. Get rid of the excess. Beautiful. And then we recap. Okay, so I have these two ready to go. You can put these back away, get rid of these. Let's go ahead and start labeling. So this one, start labeling the insulin. Insulin, 6 units, regular, expires 2021. So we can order more than the 6 units, it makes sense. So now we're going to do the famotidine. And famotidine is going to be 20 milligrams per 2 milliliters. And note there's 8 milliliters of normal saline in the syringe. Expires 2022. Only 20 milligrams per 2 milliliters. Normal saline makes sense. Yep. So I'm going to need 2 normal saline flushes. I'll bring some alcohol wipes just in case. Got all the things that I need. And bring this over to my patient room. Hello, how you doing? My name is Anthony Serpa. I'm your nurse today. I'm going to be giving you your medication this morning. So let me go ahead and perform my last check before I continue. And sanitize, provide some privacy. So you can tell me your first and last name looking at the armband. A lot of phones. Date of birth, 10/05/26. 10/05/26, beautiful. And are you allergic to any medication? Allergic to Tagamet and codeine, okay. And what are the side effects? You have a rash in your skin, okay. So we do have a medication that's similar to Tagamet. This medication is going to be your famotidine, and you just want to be aware of any side effects that you have to please let us know. We just want to be on top of it and be alert. So I'm going to do my final check before I start. So I have digoxin here, 250 micrograms. I have digoxin 0.25 milligrams. Expired 2023. Famotidine 20 milligrams. BID. Famotidine 20 milligrams per 2 milliliters. All right, and I have this is infused to get 2 milliliters of famotidine and 8 milliliters normal saline. I get my 2 flushes, and then Practa regular insulin 6 units. Practa regular insulin 6 units. Not expired. Makes sense. Okay, and this one's going to be sub-Q. Yeah, that's IV for famotidine. Okay, so go ahead and put my gloves on, and I can start talking about your medication. So for your digoxin, this medication is going to be for your age group. It's going to help increase that myocardial contraction, and it's going to decrease that heart rate. Okay, you can have some side effects, and these side effects can include some visual changes such as blurred vision. You can have a headache, and you can also have some GI upset such as nausea and vomiting. If you have these things, let us know. We can help you with those. Famotidine, this is for those stress ulcers that maybe have developed here at the hospital. And the side effects of this medication here is GI really. So you might have some diarrhea or some diarrhea, constipation. If you do have those symptoms, let us know. We have medications for those too. And Practa regular insulin, your insulin, this medication right here is for your glucose in your body. We want to make sure that your glucose levels within normal parameters to prevent any hypo or hyperglycemia. With this medication, insulin is going to decrease your glucose, so you're going to have some hypoglycemic effects. So that could be some dizziness, anxiety, lightheadedness, shaky. If you have those symptoms, let us know. We really want to be on top of that and take care of those. Do you have any question at this time, Mrs. Hollings? No? Okay. So let's go ahead and start with the medication. I'm going to go ahead and give you your digoxin. Here you go. There you go. And I'm going to go ahead and give you your insulin shot. Well, where's the last time you got your insulin shot? Do you prefer it on your left or right arm? You had it on your left arm. We're going to put it on your right arm this time, okay? So let's go ahead and clean the back of your arm. This is a sub-Q injection, so it's been 30 seconds. All right, I'm gonna just pinch, insert, release, and medicate. Sharps container, that's ready to go. And then let's go ahead and give you your medication for your famotidine. With this one, I'm gonna first flush. Let's go ahead and clean the hub here for 30 seconds. And as I'm cleaning this hub, I want to make sure that there's no infiltration or extravasation. Have you been having any pain in the AV site? No? Okay, good. So it's been 30 seconds. I'm going to go ahead and connect here and flush. All right. Just some normal sealing here, flushing. All right. And now I'm going to be giving you the medication. Alright, with this one, based on protocol and stroke guidebook, we're going to go ahead and do this within 2 minutes of flushing. Alright, so we'll flush. It's going to be 2 minutes here. Alright, it's been 2 minutes. And then we'll flush off with some normal saline. And also with the normal saline here, we're going to go ahead and flush for 2 minutes. So I'm looking on the clock for 2 minutes. It's been 2 minutes, so go ahead and release. And then we're going to clamp this right here. Alright. Alright, Mrs. Collins, well, I'm all done here. I'm just going to go ahead and get rid of this and put this in the trash. Do you have any questions for me at all while I'm here, Mrs. Collins? No? Okay. So I'll be back in like 15 minutes to check on you just to make sure everything went smoothly. You're not having any side effects, okay? And I'm gonna go ahead and give you your call light. I'm gonna lower your bed, open up your curtains again, and that's it. I'm gonna go ahead and just chart here now. I'll see you later, Mrs. Collins. Alright, so that Jackson I gave, and famotidine I gave, IV route, and then Demodex for the insulin. Right arm, I gave my right arm, the back of your arm. Go ahead and sign my name. Student nurse, SCC. Here's my documentation. Okay, I'm all done.